Thank you, Jeannie. So what happens after those people who get coronavirus recover? We're still learning that part of the story, and doctors are telling On Your Side's Jocelyn Howard about what they're now calling post-COVID syndrome.
Surviving the acute infection with COVID is only the first chapter in COVID's pandemic story.
Mayo Clinic Dr. Greg Vanish-Kishorn says typically COVID-19 patients recover within a few weeks, but doctors are finding in some cases symptoms have not fully subsided to this day.
From the start, it became clear that the road to recovery was not going to be straightforward.
There's a multitude of persisting symptoms of post-COVID syndrome, but common ones include fatigue, cough, shortness of breath, headache, and joint pain.
Individuals who have a more serious acute infection tend to do worse and have more probability of being in the post-COVID scenario.
That's exactly the case for Tommy Shepard, who contracted the virus in March.
Ended up in the hospital ICU for 24 hours.
That's where Shepard recorded videos for his family, convinced he wouldn't make it home.
The disease is strong.
Now, about 7 months after contracting the virus, he's still working through nagging symptoms.
I have inflammation within my throat, have some difficulty swallowing at times, abnormalities when I cough or I sneeze.
Dr. Vanish-Kishorn says it's important for patients to listen to their bodies. Get medical help if symptoms persist. Don't push through it.
This is something that also can get worse if someone just tries to push themselves too hard.
Jocelyn Howard, First Coast News, On Your Side.